Welcome to Acute Conversations, the official podcast of APTA Acute Care, where we share engaging conversations about acute care physical therapy, so you can connect to your profession. I'm Nicole.
And I'm Leo. Today's guests are Tricia Healy and Kim Levenhagen. We discuss the Aspire and Achieve program through APTA Acute Care, a formal national mentorship program for members, benefiting new grads, students, and seasoned clinicians.
We discuss how the relationship between a mentee and a mentor benefits all and improves patient outcomes. Let's welcome our guests.
All right, welcome to Acute Conversations, the official podcast of APTA Acute Care. Today's guests, we have Kim Levenhagen and Tricia Healy. The reason we invited them to our podcast today is because it's an opportunity for them to talk about the mentorship, the formal mentorship program that we have through APTA Acute Care called Achieve and Aspire. So I want to lead maybe with the first question, and this question is for Tricia. What's the origin story of this program, this Achieve and Aspire mentorship, formal mentorship program through APTA Acute Care?
Hey, thanks for having us on today. We're happy to share some information about the program. The inspiration came, it was a few years ago. I think it was towards the end of 2021. And there were a few things that kind of inspired me with the idea to try to develop a mentorship program within APTA Acute Care. One was a CSM lecture by Patricia Otaki about preparing for a future in acute care. And she really talked about, having role models and strategies for success in acute care. And then there were some informal discussions about, because of course we can't mention 2021 without talking about the pandemic and the effect that had on PT students and early professionals. And then I also watched a webinar, APTA webinar called The Power of Mentoring by Beth Sarfati, and it was really inspiring. She talked about how important mentoring is and some of the characteristics of mentorship and the benefits for both mentors and mentees. So those things kind of sparked the idea, and that's where it all started.
So you came up with this idea, and then how did you build it from there? How did it become so big, and what cycle are you on at this point?
Sure. So I am a member of the APTA Acute Care Practice Committee. And, that's been a great opportunity for me. It's opened a lot of doors, and it's been very empowering for me as a professional. So I kind of drafted my idea and shared it with some of the leadership. And I was encouraged to continue to develop the idea and eventually brought the concept for them to present at board of directors for strategic planning. So from there, that brings us to where we are now. We are currently in our second cohort of the program. So it's a yearly program, and it started in the fall of 2023. And we're now in our second cohort of the program.
That's really exciting. So heading into the third one,
yes,
in around August, is that right?
Yes, we will be sending out the call through some APTA Acute Care for mentors and mentees, and then the matches will be completed in October.
That's great.
I want to make a pitch regarding the practice committee, because actually it's great that Kim is also here as part of the conversation, because years ago, first time I met Kim, I wanted to get more involved. And that was one of the kind of first steps of being more involved with APTA Acute Care, was being part of the practice committee, and to see from there how to piggyback into all the different services that the practice committee puts out there in terms, regarding the documents that they put out, the lab values documents. What else do we have? There's the vital signs. Yeah, there's the vital signs documents. So a lot of good things come through the practice committee, where I've worked on with both Tricia and Kim. And so I wanted to ask Kim, what is part of it is your support with Tricia. What is your role in terms of the whole Achieve and Aspire program?
So Tricia mentioned that she brought it before the board of directors and they implement it in their strategic plan. And then I became membership chair. Membership chair of APTA Acute Care. And once I became membership chair, they handed me the strategic plan and said, guess what? The first 5 things are yours. And so I put into motion the mentoring program. But, while I was trying to think about it, Tracy Norris said to me, she's like, Tricia Healy is interested in starting this. This is something that she's very interested in.
Mm-hmm.
And so I reached out to Tricia, and Tricia let me know about some of her resources. We went and did our homework about what would be the best way to implement and get this started, and decided that at that point we could make this happen. It took several months to build the scaffolding that we needed to make this successful, but we worked together, looked at the resources, looked at best practice, and implemented it. So it's really it started out in the practice committee, but now it's under the membership committee.
Very cool.
That's really awesome. And so in the 2 cohorts, how has it gone? What kind of feedback? What are you guys finding? What are lessons learned? Tricia, you want to?
Sure. Sure. So we check in informally with the mentor and mentee pairs. And then we also check in with a formal survey about 5 or 6 months into the relationship. And that survey data has been pretty consistent, and people have been highly satisfied with the program. The biggest thing is communication, and another big part of it is the mentee's commitment. The mentee really has to have goals to drive the relationship, and we stress that it's mentee led. So the mentee leads the meetings, has the goals. So when that happens, when there's good communication and a really motivated mentee and a mentor who's willing to guide, it's been really a really successful relationship for the pair. Kind of the themes of the feedback that we've gotten is that, just being able to connect with someone. Sometimes people might work in a very small department and they don't have a lot of mentors at work. And people have said that it's really nice also to connect with someone outside of their workplace. And sometimes you find that what you think are issues just in your workplace are really issues somewhere else. And it's good to work through that with somebody else. That shared experience is very helpful. So there's been a lot of good feedback that way. Also, people are gaining insight into their career planning, and getting to speak with a more seasoned clinician. One of the pieces of feedback we got is that, somebody said they really just, developed in their career from continuing ed courses and their own research, and that they really enjoyed having somebody to connect with in their areas of clinical interest.
Tricia, I want to ask you too real quick, is that we've got some spectacular mentors that have volunteered to be a part of this. And I also want to say
self-promoting, Leo? Are you self-promoting right now?
No, I'm not self-promoting. I'm just saying that there's some fantastic mentors. I was part of the first group. I'll just throw that out there with a shout out to my mentee, Melinda Crowley, if you're listening. But I will say that there's a lot of intention behind how you set the mentors and mentees up. It's not just like a dice roll where you're just kind of randomizing people. You're very intentional about the skills that the mentors have, and then the needs of the mentees, and matching these together. And I think that, I think one of the success stories was between my mentorship with Melinda, and how that really fostered a great relationship and made some great gains in terms of her career and opportunities that's kind of led to her. And also opportunities for me to be able to mentor, not just within my local community or just within my city of Chicago, to do actually a mentorship that's, across the nation, which was pretty cool.
Yeah. Thanks for mentioning that, Leo. We really do try on the mentor and mentee interest form that people initially fill out. We really try to understand what the areas of clinical interest are, and also what the mentee's goals are. What do they really want to develop? And we try our best, and it's based on the pool of available mentors and mentees to make the best match possible based on their clinical interest and what their goals are.
Yeah, Nicole, you asked what are lessons learned. That was one of the lessons we learned. So in the first round, we had a survey to the mentors and a survey to the mentees, and we weren't as explicit on asking about goals. We were asking about practice settings. And so in this next round, we asked more about, okay, what are your goals for the mentoring program? And I think that made a huge difference in us being able to match. The other thing is that our lessons learned from, again, reading is like, we need to prioritize. So is it more important for you to have a mentor that's in the same time zone? Or is it more important that you have a mentor that is in your practice area that you want to discover? So whether it's the emergency department or pelvic health in the hospital, matching those interests together is an important aspect. And so I think that's something that we need to continue to hone in on, to find out what is the best way to match people. But there is a lot of intentionality. Tricia and I, it's like a dating game almost. Like we've got our Excel spreadsheets out and we're matching people, and
The matchmakers.
and we are. And so what happens is, and we put a lot of thought into it. It's not just random. We have like many different cells that we're looking at and trying to make the best match. I know that, Nicole and you and I work together, and one of those matches is Claire that we work with. And it's a wonderful relationship because I know Claire and I know many of the mentees and the mentors on this. And it's great because you can say, oh, this group will be great for one another. They'll build each other up. And that's part of it, is right. It's confidence building when you're the mentee. I think many of us suffer from imposter syndrome. And so myself included. And I think that that's something that the mentor-mentee group does for one another, is that they can help build each other up to show them the wonderful potential that all of us have.
I love that. And I love that you pulled in and mentioned, Claire, who has just, like you said, grown and embraced it. And, seeing that firsthand has been wonderful. I'm curious too, coming from, we both work in this larger, I guess, more medium-sized academic medical center, but in a city, right? And Leo, you do too. And Tricia, you're at UMass, right? UMass Memorial.
Yes.
Have you had any groups that you've matched, like city-based versus rural hospital? And I think I'm interested in understanding how we can make sure our physical therapists are supported across acute care facilities. Is that something that you guys have explored?
Yeah.
Go ahead, Tricia.
I think we're more intentional about matching based on their clinical interest and their needs. But, I'm sure that, like some people have said, they work in a smaller department with not as many mentors available. So in that respect, I think the program, reaches people across different areas.
Absolutely.
Yeah. I mean, Leo brought up Melinda. She's not in a big institution. So she's more at a community type hospital. And so, but that wasn't her interest. Right? Her interest was becoming a better writer or becoming more presenting or something else. And so we try to find ways in which we can match, but building on community hospitals, that's beautiful, right? So we do try to look at that as well when we're matching. Unfortunately, I like that you're trying to give us a plug now, because we would like to have more individuals from community hospitals, and we would like to have more from skilled nursing facilities. We'd like to have more people who maybe they work in orthopedics, but they work PRN in a hospital. Yeah. So all of those are great aspects of where mentoring can really benefit. We have pediatric physical therapists that are in acute care. And so expanding it from just thinking from adults to thinking pediatrics as well. We've also gone beyond our mentor list. If we look at someone and they have a real specific need, the last 2 CSMs, we've had mentors and mentee groups together. And it's been a beautiful thing, because the funny thing is they're never on our list. But what is beautiful about it is we've connected people to help build those relationships, whether it's career development, skill enhancement, confidence building, whatever it is. We feel like we're the people who can help connect people in our community of acute care therapists.
What's funny is that you mentioned CSM, Kim, and this last CSM that was in Houston. It was interesting that when I first think about mentorship, especially like right now in May, there's a lot of new grads that are going out, right? And one of the things that new grads are looking for, they're looking for mentorship in the institutions that they're working at. But actually what was interesting in Houston is that there were a handful of people that were not new grads. They've been working in skilled nursing and they're transitioning into the hospital setting, right? Or maybe they're working in one setting and maybe they want to work a little bit, like you said, more in the ER, and they're looking for some mentorship during that job transition. So I thought, that's really interesting that it's kind of manifested some of these kind of off the cuff opportunities, not just new grads, people that might have lots of work experience, but same thing with my mentee. She's actually been a longer practitioner than I have, but what she wanted in terms of her goals was more of these kind of writing opportunities and presentation opportunities, and utilizing connections like through APT Acute Care and the practice committee, we were able to kind of help set that up. Now, Tricia, I wanted to ask you, because this was kind of like your brainchild, what was your experience with mentorship that kind of made you value it so importantly, especially in terms of your profession and your career?
Yeah, I was thinking back on that too, Leo. When I was many years ago, when I was in graduate school, I do remember there was a woman who was a year ahead of me, and she really was a mentor for me, because she helped me, with sort of thinking about my resume and my experience and my looking for, my first job. And she really provided a lot of helpful hints, also with like exam prep. And she really, I do value her role in my life. So, she was a mentor. And also I think on serving on practice committee, being new to practice committee, there were a lot of people who were mentors to me in that role as well, and really helped me along the way. So those are some examples of mentorship in my professional life.
Very cool.
Have you been able to see any of the people that you work with, your coworkers, take on this role within this program?
None of my direct coworkers currently, but maybe in the future as the program continues to grow.
Yeah. Speaking of grow, so how many were enrolled over it's hard to ask you how many, because I feel like the lives you've touched through this program are exponential, right? Like, and if it's one cohort, one group, and one match, you're talking about all the patients and the community members that they are working with that benefit from that. So like, what's your size now, and what are you hoping for? Where do you envision this growing to?
Sure. Over the past 2 cohorts, we've had a total of about 65 pairs.
That's amazing.
And when you think about, like you said, if you think about the patients and the, in terms of outcomes, because of, people sharing best practices, that's what's exciting to think about. So we're not so much concerned with the numbers, we're more concerned with the quality of the relationships, and, people who are really invested in mentoring, and people, we would just like to continue to see that grow. People having good quality mentor-mentee relationships it's what's important to me.
Now, I know personally, I participated with the mentor-mentee partnership program through the neuro section, and it was life-changing, right? Like, it changed the trajectory of my career as a mentee many yeyears ago. I want to pretend like it was a couple years ago, but it was a decade or more. I guess I just think of all these 65 that you're like, where are they going to go? How are they going to be? Like, we just imagine these little seeds that are going to grow all over the country, and how that looks. Is this a precursor or a requirement of any kind for certain acute care practices? Sort of, I didn't get the sense it is, but I want to hear what you had to say. Like, it's just anybody, right? Anybody in acute care that wants to participate can?
Yeah. Anybody, you do have to be an acute care section member. So it's a member benefit, PTs, PTAs, and currently it's students in their final year of their program. So that's who can participate.
And I will say, you mentioned students. Students have free membership through APT Acute Care, another big perk of being part of APT Acute Care. So especially in that last year, I think that's great. And I think that's a great opportunity in terms of students that are getting ready to graduate and might have a lot of questions about interviewing or what to look for in a new job, or what types of things should I be on the lookout for? Is it, if the pay is not as competitive, are there other things I should be asking for? Or how can I kind of bolster it if pay is not competitive? Or what are some of the other perks and some of the other benefits?
Mm-hmm.
And, one thing I wanted to ask the two of you, do you have any kind of bright spots and kind of great stories to share from some of these mentor-mentee relationships you've seen in the past two cohorts? Any kind of fun stories that were like, oh, wow, this wasn't expected, or, you started this and then all of a sudden you've seen that mentor-mentee relationship just blossom?
Well, Kim, I remember,
Oh.
remember when we were at CSM in Boston and we saw the first mentor and mentee meet in person, and how just excited they were to actually meet in person after, starting their relationship, online or, through their Zoom meetings. That was just they were just so thrilled to meet each other. And that was exciting.
Because they had only talked to each other like by phone or by text or something like that. And so it was like when they met, like it was a movie, right? So they see each other and they squeal, and it's like, and we're just standing there like, okay, well, we've got this room. I don't know if everybody else, but it was interesting because then they went off into like, two chairs, and you could see that the world could be blowing up around them, but they were so engrossed in each other's conversation. It was such a beautiful thing to watch. So thanks for reminding me of that. That was a great bright spot. Yeah. So one of the things, Tricia and I have been talking a lot about mentoring, but when, you brought up about students, Leo, and about free membership, and we have grown exponentially with student membership, right? And so how do we foster students? And so we now have a student leadership group within APTA Acute Care. And one of the branches that Tricia and I, and the reason we have it in that final year is for what you said, getting that mentorship for jobs, how to apply for a job, how do I get into acute care? But there's also students along the way that need what we call coaching, right? So they need more goals, they need more hand holding, they need more rah-rah cheer type things and more specific instructions. With mentor-mentee, it's more mentee-led goals, coming up with more of a building a relationship, building communication. So one of the things that we hope to build in the future, and which is kind of a bright spot for me, is helping build this coaching idea for our students who are interested in acute care. So how do we help them that are interested in acute care either look at a job or think about clinicals, or even students who weren't thinking about acute care? How do we get them interested in acute care? And so, I mean, your program and my program, we rah-rah acute care, but not every programs are rah-rah acute care. So it is, I think that's something that we would like to explore in the future, and maybe this with the student leadership group. But I think that that's another avenue that we could improve on. And that would be a really bright spot for me, is to get more students jazzed about acute care.
I love this. When we think about, like, Tricia, you were saying you started in 2021, right? And we can't talk about 2021 without talking about 2020 and COVID, the impact it had on our profession in acute care, where there were hospitals saying, no, physical therapy can't see any of these patients. And then there were other hospitals where the physical therapists were in charge of the turn teams, and sort of how did we position ourselves? And then, the struggle of getting students into hospitals when everything was real lockdown, and what that looked like for years to come, and losing those clinical instruction sites. And then Kim, you talk about the differences like between clinical instruction of a student, coaching of a student, and then mentoring either as a student or beyond into the career. I guess when you are bringing a mentor on board, how do you help them transition into this new type of role? Like you said, it's very mentee led. The support services that this is providing for them too.
So we do, when we first introduce, the pair by email, as you said, we do really recommend that the mentee contacts the mentor. We provide guidelines for successful mentorship, and really try to give an outline of what that looks like. And we also provide just some general activities that people can do in their meetings, like sharing professional resources, favorite journal articles. We've had mentors and mentees kind of review a case study together, and that's been very helpful. Talking about career path, and we have to give credit to the mentor and mentee for coming up with this. But one mentor said to his mentee, she had felt like she had been passed over for something, for a promotion or something at work. So he said, come up with an elevator speech that you can have prepared about your value to what you bring to patients. And that just seemed very powerful. It seemed like such a great thing to work on together, and something very practical that, really helped the mentee to be able to, know their worth, so to speak. So that was really interesting.
That's a really great exercise. Any exercises, Kim, that come to mind for you? Like what exercises did you learn about through the mentor-mentee relationship?
Yeah, that's a great question. I was thinking about, what Tricia was saying, and many times it's just kind of listening, and because it's easy for me to come in and say, well, you should be doing this and you should be doing that. But what that mentee and mentor relationship did that Tricia just described is the person expressed frustration, right? And said, these are some things that are really frustrating to me. But what the mentor heard is, you know what? I see this value in you, but are you seeing that value in you? And maybe you should express that and empower them to be able to express that out loud. So I think that is a powerful thing that we can all possess, and think about, okay, all of us have worth, all of us have value. It's the mentor that is building that relationship, building that confidence, so that person finds their value and is able to express their value. So I think that's, if I have always remind myself that I have 2 ears and 1 mouth, and probably should listen more than I talk. I'm not 100% good at that, but I'm trying to get better at it. But if I just stop, pause, allow the person to talk and express, then we can work on some problem solving together. But it really needs to come, just like it does for our patients, right? It really needs to come from the individual. So
true words.
It's great just thinking about my experience with mentors. I remember being a student, being a new grad, working in an acute care setting. And what I think my mentors kind of provided for me was to kind of see like, wow, like one day, many years down the line, I might actually be able to be as cool as some of these people that are presenting. And that's how I met Kim. It was Kim and a handful of other people that are big names for APT acute care. They were doing a presentation, and the things that they were talking about were just so inspiring and eye-opening. Wow, they do this in this hospital. They actually will mobilize patients just because they're getting a transfusion. That's not a reason to halt all therapy, and they're working with patients on vents. It's just like, this is cool. I want to do that. I want to be like that when I grow up. And sure enough, it's like those mentors, I was able to see myself as the potential of being able to achieve that. So I think that's what's one of the big perks about mentors. And like you were saying, Kim, some of these maybe students or those people not yet in a mentor and mentee relationship need some coaching for them to kind of maybe see that potential of what can be achieved, and having these great mentors as an opportunity to look at, oh, wow, this is what we can do, in our acute care setting. This is how valuable we are. And then these mentors, they're so good at being able to articulate how valuable we are in terms of the healthcare team. That was another thing that I learned. It's like, wow, I never heard this articulated in such a way of how much value we bring. And so it's kind of evolved from just being able to work with patients to advocating for acute care therapy and for our whole profession, which has been pretty cool. So the trajectory's been fun, and being able to pay that back to the next generation of students that are coming up. I just want to say thank you for giving both the mentors and mentees, this great opportunity. Now, where can people find out about Achieve and Aspire throughout your program?
So I think you'll be sharing the link to the webpage,
Yep.
but stay tuned because we'll be sending more information out about the next cohort.
Right.
That will be in Critical Edge in the August edition. So at that point, people can fill out the form if they're interested in being a mentor or a mentee. And also there'll be an email going out to members right around that time.
Fantastic.
Can't
That's
wait.
awesome. Well, Nicole, I think it's about time it's about that time that we go into our rapid responses.
Mm-hmm.
So, Tricia, Kim, are you ready? And I assume that you know how rapid responses work. Just like in the hospital, we got to move quick.
Yeah.
These rapid fire questions, the first thing that comes to mind. I'll start off with, actually, no, Nicole, do you want to start for the first question?
Sure, I will start out. If you did not work in healthcare, what would your career be?
Bartender.
I got the next question. Tricia, what's your most favorite scrub color to wear at work?
Navy blue.
Navy blue.
If you could win one award, Kim, what would it be? Nobel Prize, Oscar, or Olympic gold medal?
Ooh, Nobel Prize.
Good choice.
Tricia, before you walk into a patient's room, what would be your theme song?
Ooh. Don't Stop Believing.
Don't Stop Believing. I love it.
Oh, that's a good one.
Yeah,
I was going to say a Beyonce song.
Yeah. Kim, what's your favorite outcome measure to use in acute care?
Walking speed.
Ooh. Yeah.
Well, AMPAC will be there too. Okay.
You love the impact.
I do.
Tricia, name a PT that's been influential in your career.
Mm-hmm. Well, Kim has been a great partner in this program, and she's been a mentor to me, and she knows a lot more about Excel than I do.
I will vouch for that. She is an Excel black belt for sure.
She
100%.
is. and also Tracy Norris, because she was chair of practice committee when I started on practice committee.
Fantastic. And that brings it to about a full minute. And so we're going to have one last question, and I'll direct this to both of you, Tricia and Kim. You know you were working on acute care when, finish the sentence.
When you correct the physician's office about how they take vital signs.
It's supposed to go to the heart.
I have to go with you keep a separate pair of shoes at work that doesn't come home with you. That would be my Dansko clogs.
That's right. That's right.
We all have a pair of those. Yep.
Yes.
Awesome. I want to thank again my co-host Nicole. Thank you for being here for the podcast, and again our guests Kim and Tricia to talk about the Achieve and Aspire program and mentorship. Thank you, and thank you for the mentorship that you've given us throughout the years. Thank you so much, everyone.
Thank you.
Thank you for having us.
Much. Thanks for having us.
We would like to thank Tricia and Kim for joining us on the podcast. Acute Conversations is the official podcast of APTA Acute Care. This episode was hosted by Leo Arguelles and Nicole Neveau. Executive produced by Katie Brito and Edward Mathis. Music by Alexia Action from Pixabay, sound effects also from Pixabay. For more information about APTA and Acute Care, be sure to check out our show notes for links and resources from the Academy. If you found value from our podcast, please be sure to subscribe, follow, and share with your friends and colleagues. Join us next time for another engaging acute care conversation. Thank you for listening, and may your shoes and scrubs stay clean today.
I can't see you because I have this up on my screen.
Okay. And go.